Hello, and welcome to another edition of Medicare Simplified with your host, Dave Miller.
Hello, everyone. Welcome back to another edition of Medicare Simplified. Today, our journey is going to take us right down the heart of Medicare, looking at Parts A and B. Part A, as you recall from a previous edition, is free as long as you've worked 40 quarters and paid taxes. You get it for free. So let's see what you get for your money. It comes with a $1,600 deductible per benefit period. Now, a benefit period starts on day one you're admitted to the hospital and ends 60 days after your discharge. This 60-day window is to give you a chance to recover, and if anything goes wrong where they have to readmit you to the hospital, you won't have to pay that deductible again. But like a car warranty or something like a TV warranty, things break after the warranty is over. So if day 70 comes along and you have to be readmitted, you will be obligated to pay that $1,600 deductible again and start a new benefit period. But while you're in the hospital, the first 60 days are covered through your deductible. If it's a longer stay, 61 to 90 days, it's $400 per day. Days 91 to 150 is $800 per day. And anything after 150 days, you're paying for everything. I don't think I need to talk much longer about getting secondary coverage to help cover your medical expenses. That right there is enough to sell me because it's going to be expensive. Medigap and Medicare Advantage, which we'll talk about in a future episode, are designed to help you out with the cost share. We need to look into those, and we will. Now, while you're in your benefit period, you can get skilled nursing, providing you've had a 3-day minimum hospital stay and have days left. So the first 20 days, there'll be a daily copayment. Days 21 through 100, it could be up to $200 per day. Anything after 101 days, you will pay full cost. Medicare will pay for durable medical equipment, and you will have a 20% copay on that. Now, when it comes to hospice, I'm a little upset because all you get for hospice, you can get your prescription drugs and similar products for pain and symptom control at home for $5. Durable medical equipment for respite care at 20%. I really think Medicare can do better than that, and maybe in the future they will, but it's better than not getting anything. With that in mind, let's go on to Part B. Part B in 2023 has a premium of $164.90 unless IRMAA comes into play, which we discussed on a previous episode. Now, your deductible this year in 2023 is $226. Part B covers 2 types of services: medically necessary, like clinical research, ambulatory services, some medical equipment, doctor visits, and that is your regular doctor as well as any specialist like a heart doctor, lung doctor, what have you, and some drugs like HIV, AIDS, chemo, and drugs that have to be administered in either a hospital, clinical, or doctor's office. It also covers preventive services such as a flu shot, pneumonia shot, pap smear, mammogram, and all these other things that we do to make sure to try and battle cancer before we actually get it or detect it early. I can't emphasize getting colonoscopies every year. I've had a friend who is suffering from cancer because they put it off and they're fighting for their life. Please get these preventive services taken care of. Now, let's look at outpatient care. After you've met your Part B deductible, you're required to pay 20% of all Medicare-approved services. Outpatient services can vary in most cases, and the copayment will not exceed the Part A deductible, which this year is $1,600. Some examples of outpatient services are colonoscopy, bronchoscopy, appendectomy, and if you need to get advanced imaging such as an MRI or CAT scan and have to have it done in a hospital. Now, this can get a little expensive, but again, secondary coverage will help you out with that. Now, an example of how the Part B deductible works. If you're admitted to a hospital and you're obligated to pay your Part A deductible and your Part B deductible because the surgeon is covered under Part B, the hospital's covered under Part A, so you just met both your deductibles real quick. If you've already met your deductible, then you would pay 20%. So let's take a look at how this deductible works outside of a hospital. Let's say you hurt your leg and you went to see a doctor and the bill is $100. Now, I'm being lowballing here, but we know it's going to be more than that. But if the bill came to $100 and you have not satisfied your Part B deductible yet, that will go towards the Part B deductible, and you'd only have $126 left to meet the deductible for that year. If you have met your deductible, then you would pay 20% or $20 because that's 20% of 100. Now, again, with the hospital, it can be expensive without secondary coverage. So let's say you had surgery and you're in the middle of your deductible and you have to meet it. So now if you've only paid $100 towards your deductible, you'll pay to $126, you'll satisfy your Part B deductible, and now you're covered. And Part A deductible, of course, in a hospital environment, you'd pay the full $1,600. So with that in mind, let's say you're in your benefit period for heart surgery. You fell and broke your leg or your hip. Now you got to be readmitted to the hospital. Now, because this is not related to the heart surgery, it creates a whole new benefit period, which means, yes, $1,600 A deductible and 20% of all Medicare approved charges, because you've already met your Part B deductible on the first trip to the hospital, and your benefit windows are going to overlap. This has happened in the past. It'll happen in the future. And some people have had 3-4 benefit periods in 1 year. It was not a good year for them. So with this in mind, look forward to hearing me talk about Medicare Advantage and Medigap in the near future. Now, one of the questions that I get asked from time to time is what is not covered by Medicare? Well, some of the things that are not covered is long-term care, such as custodial care. Almost any dental is not covered. Eye exams for prescription glasses is not covered, but a glaucoma check, and if you're diabetic, a retinal myopathy check is covered. Dentures are not covered. Cosmetic surgery, massage therapy, that's a bummer. That's not covered. Hearing aids and exams for fitting are not covered, and concierge service is not covered. If you're not sure if something is covered or not, you can go to medicare.gov/coverage, and there'll be a window pop up, and you can type in your question there, and the internet might be able to help you find the answer. But what I prefer to do is use Medicare account that we created called My Medicare. Log in, you can go to the chat window and chat with the experts. They know the answers, and they will give you the best answer possible. And that's why it was imperative you tuned in to that episode where I talked about mymedicare.gov and created your account. If you haven't done so, rewind a couple editions and watch that one because it was very easy to follow. And I guarantee you, you will definitely want to get that account. Now, this has been another edition of Medicare Simplified. I hope you enjoyed it and found it informative. I look forward to speaking with you again soon and continuing our journey. Have a great day. If you've enjoyed this podcast and don't want to miss future episodes of Medicare Simplified with me, Dave Miller, please subscribe wherever you get your podcasts. And don't forget to check out my book, Medicare Ready, Set, Go, available on Amazon in paperback and Kindle format. If you're looking for Medicare advice, please reach out to me at dave@mig4u.net or online at mig4u.net.